Dr. Joe DeStefano here for Urgent Care 24/7. We're going to chat today about iron disorders. So that's the broad spectrum of iron deficiency. There are people that are iron deficient that have a defect in their GI tract. You do a big workup on them. They don't have ulcers. They don't have Crohn's disease. They don't have a cancer. They swear compliance with their iron. They tell you that their stools are black from taking iron, and they are still iron deficient. These people actually have a problem with their iron transport genes and don't absorb oral iron well. They will need IV iron infusion. Now, the other problem with iron is iron overload syndrome. Hemochromatosis, we call it. The most common cause of hemochromatosis is hereditary hemochromatosis. The most common gene causing this is Y2A2. The next most common gene is HD63. The next one goes by the name 4S or other names. They're finding other minor genes often, but the two main ones to worry about is Y2A2 and HD63. Hereditary hemochromatosis is the most common genetic disease of Caucasians. It is extremely common in Europeans of Scottish and Irish descent. The highest levels of symptomatic hemochromatosis are found in western North Carolina, upstate South Carolina, middle North Carolina, wherever there was a very high population of Scots-Irish. Nova Scotia, New Scotland, of course, has a lot of hemochromatosis. New Zealand, settled by a lot of Scots-Irish, a lot of hemochromatosis. Hemochromatosis in males develops historically about 10 to 20 years earlier than hemochromatosis in females. This is changing, however, because the new birth control pills that allow women to only have periods 4 times a year, 2 times a year, mean that if the woman has like 2 genes, they're what we call a Y2A2 homozygote, they will start to acquire large amounts of iron just like the male would. The early signs of hemochromatosis, the asymptomatic phase as we call it, a lot of times may just be some depression, some fatigue, some insulin resistance, blood sugars start to get a little bit high, some aches and pains, just almost like a chronic fatigue syndrome is the what I would call the early phases of iron overload syndrome, hemochromatosis. As the disease becomes more advanced, the iron starts to deposit in the testes, it starts to deposit in the pituitary, it starts to deposit into the amygdala of the brain, it starts to deposit on all the articular surfaces of your joints. So as the iron overload syndrome becomes worse, the patient will develop arthritic symptoms. They will develop what we call a bronze diabetes because they become diabetic from increased insulin resistance from the iron, plus iron poisoning the isolate cells in the pancreas. Plus they'll have a pretty bronze tan with no tan lines because their skin is filled with iron. The more severe cases, the iron shows up in the MRI scans of the brain. So that is what I would call, and of course, advanced hemochromatosis causes cirrhosis of the liver. As the liver fills with iron, trying to control the iron levels in the blood. Also, these elevated iron levels escape the body's ability to sequester iron from microorganisms. So people with high iron levels in hereditary hemochromatosis will get life-threatening bacterial infections that normal people will not get, such as Vibrio vulnificans infections from walking on the beach. So iron level monitoring is important, especially in high-risk populations in the southeast United States. It should be considered as part of any depression workup, check for iron overload, since often depression is one of the first presenting symptoms. And be aware of your family history. It is hereditary hemochromatosis is hereditary. These genes are passed down in families. Often the families will have clusters of depression, suicide, cirrhosis. Be self-aware of your family history and your ethnic background. We are aware of it in Urgent Care 24/7, and it's part of our overall holistic approach to healthcare. We try to make sure that we know the iron saturation levels of our patients. This is Dr. Joe DeStefano. Thank you for this time to chat with me about iron disorders. Urgent Care 24/7. Life is 24/7, and so are we.